Hello and welcome back to the TMDSAS Podcast. This is your host, Enrique Hasso, the coordinator of the Texas Health Education Service in Austin, Texas. Throughout the Roadmap to Professional School series, we've explored what applicants should be doing during their freshman, sophomore, junior, and senior year of college. However, there's a whole group of students who don't have as quite of a set pathway as a traditional student would, and these are our non-traditional students. Today we'll be exploring what a non-traditional applicant needs to do in order to excel and forge their own pathway into professional school. To do that, we will define the term non-traditional and to which kind of applicants that applies. We'll cover a holistic review for non-traditional students and what that looks like in practice. How you as a non-traditional applicant can stand out in the application and leverage the questions in the application in your favor. We'll be digging into what you should be doing as you are researching your own pathway into professional school. And we'll round out the episode with resources available to non-traditional students. Let's go ahead and get started. When defining the term non-traditional, we're talking about applicants who have had a short break in education, perhaps a year, or a long break in education, perhaps 20 something years or 30 years or 10 years or 5 years. A lot of these folks are in their second, maybe even third careers. A lot of our non-traditional applicants tend to be veteran or active military members. And these are just folks who have followed other journeys to make their way to professional school. Historically, TMDSAS has identified non-traditional applicants as those who are 25 years or older. However, starting in entry year 2020, applicants can self-identify as non-traditional. And don't forget, there is no disadvantage to being a non-traditional applicant, and there's definitely no disadvantage in you identifying yourself as a non-traditional student. Digging into holistic review, I know I get on the soapbox often, but the core competencies are really, really important when you think of the application as a whole. Just as a reminder, there are 4 main categories for the core competencies, and there are several different competencies within each of these. So I'm just going to go down the list. We have the category of interpersonal competencies, which are service orientation, social skills, cultural competence, teamwork, and oral communication. There are intrapersonal competencies, which include an ethical responsibility to self and others, reliability and dependability, resilience and adaptability, and a capacity for improvement. We also have the core competency group of thinking and reasoning, which include critical thinking, quantitative reasoning, scientific inquiry, and written communication. And we finally round out the competencies with science, which cover living systems and human behavior. Your application consists of several different aspects. Looking at it from a wide lens, your application is going to consist of your GPA, which is broken down several different ways, including undergraduate GPA, graduate GPA, your BCPM GPA, which includes biology, chemistry, physics, and math courses, your science GPA, a non-science GPA. It's just slashed every which way. And even then, it's still divided into what you would traditionally consider your freshman, junior, sophomore, senior year, post-bac, graduate work. And so there are a lot of different ways that your GPAs are calculated and how the schools see them. And these different breakdowns allow the schools to be able to quickly identify where there is a different trend in your GPA. So for example, if your GPA started off very low as a freshman in college, years ago, and as you progress through your undergraduate career, it kept getting better. And now that you've gone back to do post-bac courses, you are totally nailing it with a 4.0. You're going to see that upward trajectory in your GPA, and the schools will be able to see that very clearly. The next part of your application is going to be your test scores, your MCAT or your DAT. These are very important. And unfortunately, in talking about holistic review, a lot of people really downplay the importance of GPA and MCAT. However, these 2 parts of your application really tell the admissions committees and tell schools that you are academically prepared for the rigors of that school. So unfortunately, holistic review is important, but it really doesn't kick in until you can prove that you're academically prepared. And the biggest way that you can prove that in your application is going to be through a competitive performance on your tests and a solid GPA. The next part of your application is your essays, which will tell the story of why it is that you want to pursue this career. Your letters, which are an outside perspective of why you would be an effective healthcare provider and how you can handle the rigors of professional school. Your activities, which give a historical reference point to how involved you are in providing back to the community and in serving as a leader, and also to give an additional dimension to see what it is that you're able to do on the side, which is why we have the extracurricular and leisure section as a category for the activity section or your personal biography in the TMDSAS application. The schools want to see somebody who's well-rounded and is really competitive in their activities, but also someone who knows how to have a life outside of this realm and replenish themselves. The other aspect of your application is going to be your interview. A lot of people take this for granted. Being invited to an interview is a very big deal, and there's a lot of preparation that you need to be able to put on your part for that interview. As you'll recall, Mr. Vasquez really talked about how it's not just an interview time slot, but rather an interview day where you're under the microscope from the moment that you show up to that campus to the moment that you leave. And every person that you're interacting with could potentially have a say into whether or not you get into that school. Finally, we have an other section. Is there another part of your application that really shines and really contributes to who you are as a person? And I wanted to emphasize that all of these different areas work in tandem with each other to complete your application as a whole. And so I want you to look at it from the perspective of you have the academic side, which is your, for lack of a better word, ticket for going into holistic review. And in the end, once you're in the holistic review part of it, all of these things work together. Your MCAT, your GPA, your essays, your letters, activities, and your interview are all working together in telling the schools how good of a fit you're going to be at that school. As non-traditional students, you really need to do your research, especially if you're just starting off on your journey. Go and explore the admission statistics and figure out how competitive you are. TMDSAS has these posted on the website. Check out ACOMAS. Check out the MSAR provided by the AAMC so you can explore the averages, the highs and the lows of the ranges of applicants that are accepted to these schools, and figure out which schools would be in your target range. Next, go into exploring your academics. What will it take to get you to where you need to go? What courses do you need to complete in order to fulfill not just the prerequisites, but go above and beyond and prove that you are academically prepared for the rigors of professional school? What GPA is needed and how are you going to get there? Figure out what your MCAT preparation plan is going to look like, or your DAT preparation plan is going to look like. These are not tests that you can jump into and just expect to perform well. There's plenty of preparation that needs to go into these, and there are a lot of strategies that you need to explore to be able to perform well under that tight timetable on test day. Also, explore different programs. For example, in Texas, we have Academic Fresh Start, which is essentially an option for applicants to remove any course that is 10 years or older from consideration in GPAs. This does not mean that these courses disappear. You still have to report them in the application, but they are no longer, by law, able to contribute to your GPA. And this is an excellent option for a lot of folks who may have not done as well as an undergraduate student, but are now on the pathway to being very competitive. And Academic Fresh Start is an excellent program. If you'd like to know more information about Academic Fresh Start, Mr. Meeks, the director of TMDSAS, and I go into detail in episode 30 of the TMDSAS podcast. Is Academic Fresh Start right for you? Continuing the research, you want to build a coalition of support. This is going to include your family, your friends, colleagues or supervisors, advisors, both at your undergraduate school and health professions advisors, your professors, any doctors or dentists that you are shadowing or that you have networked with, mentors that are going to help you get to where you are going, and peers that can really give you their insights and to how they've tackled different challenges. Also, don't be afraid to network with schools. There are a lot of open house events that we share via our online communities, different outreach events, such as when the schools visit the undergraduate universities for a Health Professions Day, and also webinars or other groups, such as Club PreMed, which is run by the Long School of Medicine, where they host monthly webinars. This coalition is really going to help support you as you're making these difficult decisions and rearranging your life essentially to help you meet this goal that you're setting for yourself. And they're going to be pivotal in making sure that you are successful. Next, you need to get ready for your application. Start finding those direct healthcare experiences where they are either shadowing experiences, preceptorships, scribing opportunities, or any other opportunities for you to get direct healthcare experiences. Don't forget about volunteer activities. And these are just activities that are specific to what you are personally interested in. And what they tell the admissions committees is that you're interested in helping others in different capacities. So a volunteer activity doesn't necessarily have to be healthcare related. Also, your extracurricular activities. What is it that you like to do outside of school, outside of your home life, outside of your pursuit of this goal? Don't forget that if it's important to you, it'll be important on your application, and that passion will come through and become important to the admissions committees as they are interviewing you and as they review you for consideration. Be organized and build your own pathway. Be organized and start setting a plan on what it looks like for you to get into professional school. With all of the different things that you've researched so far, you have a very good idea on what it's going to take for you to get to where you need to go. So build your plan around what it is that you're currently doing. Don't try to put your life on pause to pursue your goals. Make sure that you're maintaining your wellness, your well-roundedness, and your structure intact as you're continuing to pursue these goals. Finally, explore finances. An excellent resource for this is the AAMC's FIRST, FIRST, which stands for Financial Information, Resources, Services, and Tools. And they have a lot of excellent resources on there, such as a medical school cost calculator, different resources on financial aid and seeking out assistance, and a lot of great tools for you to start exploring what that's going to look like when you get to professional school. If you do need to pursue a post-bac experience, there are some things for you to consider. A lot of post-baccalaureate programs have pipeline agreements to medical schools, where if you join these post-bac programs and you successfully meet all of the criteria set, you have a direct pathway into professional school. Some of the questions that you want to explore as you're looking into post-bac programs are whether the MCAT preparation or DAT preparation is built into the program, how long the program is, what their record is on getting students to matriculate to professional school, and whether or not the program is of cost value to you as an applicant. There are some well-established post-bac programs that you can explore, and there are also some DIY, quote-unquote, post-bac programs that you can go off and look into as well. Some of the established post-bac programs in Texas include the University of North Texas Health Science Center Biomedical Science Grad Program, the Texas Tech University Health Sciences Program in Lubbock, the University of Incarnate Word School of Osteopathic Medicine, Baylor College of Medicine, MD Anderson School of Health Professions, MD Anderson UT Health Graduate School, the UT Dallas, Texas A&M, and University of St. Thomas post-baccalaureate programs all offer a lot of resources for students who are pursuing that pathway specifically to get into professional school. So go off and do some research into these schools if a post-bac program is right for you. Don't forget that your performance on a post-bac program is going to affect your undergraduate GPA. So if you need to raise your GPA just a bit, a post-bac program is a great way to show that you are academically capable of handling the rigors of professional school, because the courses that you'll be taking in this program are of the upper division level. And those are really going to help show the schools how academically prepared you are. This is especially an important consideration for applicants who essentially have to take courses all the way to the point of matriculation to professional school. Next, we're going to discuss how you can use the application in your favor to stand out as a non-traditional applicant. Don't forget that the schools want to see applicants who have life experiences. Figure out how it is that you can connect with the human condition, and you've heard that term several times as we've talked to the deans across the state. And really think about what it is that you bring to the table, not just to these professional schools, but to the profession as a whole. And you won't have a full perspective of what that's going to look like as a pre-health professional, but we all have a working idea of what an effective healthcare professional is going to look like in terms of the care that they provide to patients. The first part of the application you really want to focus on is going to be your essays. And as you'll recall, the first essay is a personal statement, which is going to cover your typical explaining your motivation to seek a career in that profession and how your experiences have prepared you to pursue this pathway. This essay is only 5,000 characters, but in it, you'll want to really nail down the message of why you decided to pursue this pathway and think about why it is that you want to pursue it now. As you talk about your pursuit of this profession with family, coworkers, friends, you're pretty sure to have nailed down this purpose already. And so it just falls onto you to really explore the different experiences that you've had and derive the value from them to discuss in this essay, so you can show how these experiences work in tandem with your motivation to pursue a career as a dentist, doctor, or veterinarian. The second essay is a personal characteristics essay, which asks you to describe your personal characteristics, background, talents, skills, etc., and how these experiences are going to add to the educational experience of others. So think back about which skills, which characteristics, which competencies you have developed, whether it be in your personal or academic or professional life, and how those come into play as you envision yourself in that professional school setting. Finally, the optional essay, which I'll remind you is not optional for veterinary applicants. However, for medical and dental applicants, you have the opportunity to use this optional essay to bring to light different parts of your application. For example, if you have an activity that wasn't fully discussed in the activity section and you identified it as a meaningful activity, but you still weren't quite able to capture the essence of that activity, you can use the optional essay to go further into depth into that. The optional essay is essentially the last opportunity you have to discuss something that wasn't previously discussed in your application. So I suggest you save this one closer to the end of your application and then come back to it to fill in any other areas that weren't already discussed or discussed with sufficient detail in other parts of your application. The letters of evaluation are an integral part of your application. What these letters tell the admissions committees are that the person that they're seeing on paper is in fact somebody who is presenting themselves in that manner to the outside world. And so a letter of evaluation can be written by a physician, dentist, professor, supervisor, volunteer coordinator, anybody who can really explore all of the different competencies and strengths that you're trying to show in your application. And so this is where it really becomes important for you to build that coalition of people who are going to support you along the way. And it's important to go into this knowing that at the end, you're going to have to ask for this evaluation from these folks. If you attend a university that creates a health professions packet, they help you in creating a unified message on what these different letters are saying about you and how it supports your application. However, if you have to submit your letters individually, it's up to you to figure out how these letters are going to expand on your strengths and highlight the different areas of your application that you want to show the admissions committees. New in entry year 2020 is the non-traditional applicant essay, which is really just a short paragraph, only 1,000 characters, that allows you to talk about why you've identified yourself as a non-traditional applicant and what it is that title means to you. Don't dwell too much on this question. It's just an opportunity for you to talk about your experience as a non-traditional applicant, but you really want to get to the heart of what it means to you to identify yourself as a non-traditional student. Perhaps your journey was a little bit more scenic than you had originally intended, but you can use this essay to talk about why it is that you want to pursue this career, or why it is that you want to come back to want to pursue this career. Save the more important details for your essays, however, because that's where a lot of the schools are already looking for really profound answers as to why an applicant wants to pursue this career. Finally, I wanted to share some resources for non-traditional applicants. For a lot of non-traditional applicants, you don't have immediate access to an advisor, rather, whether it be because you've graduated and it's been a few years and your health professions office doesn't offer assistance to alumni, or if you are not currently in school, or if you're just seeking additional assistance. A lot of folks don't have ready access to a health professions advisor. If you find yourself in that position, you can reach out to the NAAHP, that's NAAHP. It's the National Association for Advisors of the Health Professions, and they have a volunteer advisor service, and we've included a link to that in the description of this episode for you to check out. You simply fill out a quick email with some information about you, and you're paired with a health professions advisor who's volunteered to assist students who don't have access to health professions advisors. Another great resource is the PreMed Years podcast that Dr. Ryan Gray hosts. In that podcast, he has several discussions with non-traditional applicants, including session 343 with Mila's 17-year-long journey to medical school. And these are really great to help inspire you, most importantly, to learn that you're not alone in this journey. There are a lot of people out there to help, and there are a lot of people who have figured out how to overcome certain obstacles. And it's really inspiring to hear how they've overcome these. And so Dr. Gray has done a really fantastic job of reaching out to non-traditional students and to explore their journeys on his podcast. Another great resource that I'd like to plug is the TMDSAS Non-Traditional Applicants group. In this Facebook group, you have access to hundreds of other non-traditional applicants who are going through different parts of their journey and are really talking about what it is that it's taking for them to overcome different obstacles. You can also connect with TMDSAS staff who can answer questions about the application, advisors who can give insights into what you can do to prepare, and professional schools who jump in to give insights into what it is that they're seeking in applicants. This is a fantastic opportunity and a really collaborative group that allows applicants to connect with each other and share their experiences and learn more about what it's going to take for them to be the best applicant they can be. Take a look at your application as a whole. Your test scores, GPA, essays, letters, activities, and your interview are all going to work in tandem to get you into a professional school. Do your research and explore admission statistics, the academics, and what it's going to take for you to get there. Build your coalition of support. Get ready and start getting involved in different activities that are going to get you to your goal, and get organized. Leverage the application in your favor. The TMDSAS application has plenty of opportunities for you to highlight who you are as an individual and why that's going to make you a more effective healthcare professional. And know your resources. While I've only listed a few here, there are plenty of resources available to you. But know that in the end, you are the one that knows your journey best, and it's up to you to figure out what it is that you're going to implement on your own journey. TMDSAS Podcasts is a proud affiliate of MedEd Media, your source for informational, inspirational, and motivational PreMed podcasts and more. As non-traditional applicants, I highly suggest that you check out the Old PreMeds podcast, which is a weekly podcast for non-traditional pre-meds. We also invite you to join one of our online communities on Facebook, including the Non-Traditional Applicants group focused on non-traditional students, and the TMDSAS Hub, which is open to all applicants. On behalf of everyone at TMDSAS and the Texas Health Education Service, we'd like to wish all of the applicants all the best of luck as they pursue their own journey into professional school. That's all for today. We'll talk to you later.
This is MedEd Media.